Now we are going to look at the mnemonic for sacral plexus, and that is L4, L5, S1 gives rise to the superior gluteal nerve. Now here is L4, we will cut L4, the remaining will be L5, S1, S2. It gives rise to the inferior gluteal nerve which innervates gluteus maximus. Then we will cut L5, S1, S2, S3 gives posterior cutaneous nerve. When we will cut S1, when we will cut S1, then will come S2, S3, and S4 gives rise to the pudendal nerve. So in this way, these nerves are coming, and when we will combine L4 to S3, it will give rise to the sciatic nerve, and in this way, sacral plexus is formed. So before basics, we will have to look at the basics in our ANS. A autonomous nervous system has two types: parasympathetic and sympathetic nervous system. Parasympathetic nervous system has 12 cranial nerves, and sympathetic nervous system has chains, sympathetic chains, and sympathetic ganglion, which are arranged paravertebral and perivertebral ganglion fashion. Now what happens? Sacral plexus is S1, S2, S3, and S4, while lumbar plexus is L4 and L5. Lumbosacral plexus is from L4 to S4. Now, what happens? There it gives to the different nerves: superior gluteal nerve, inferior sciatic nerve, posterior femoral cutaneous nerve, and pudendal nerve as well. Now, as you can see in this representation, let's suppose there is aorta descending downwards. In front of aorta there is superior hypogastric plexus, adjacent to it there is lumbar plexus coming down, and at this position below the superior hypogastric plexus there is inferior hypogastric plexus, and it gives to the different splanchnic nerves. Now, sciatic nerve is the longest branch of the sacral plexus. It has a nerve root of L4 up to S3 except S4, and it runs down in the back of leg from adductor magnus, divides into the common fibular and tibial nerve, and then common fibular nerve divides into deep and superficial fibular nerve. So in this way, nerves of sacral plexus are formed, and then they innervate the organs of pelvis and perineum like vesicular plexus, prostatic plexus. Some of them supply uterus as vagina, and then rectum hypogastric plexus. So in this way, nerves of sacral plexus are formed. Then we will be looking at the superior gluteus nerve. It supplies medius and minimus, while inferior gluteal nerve supplies gluteus maximus. So in this way, these nerves innervate different muscles.